Interviewing patients can be a difficult task when you don't know where to start. So in today's video, I'm going to show you how to use indirect questions and funneling questions to make it easier for you. Let's get started. Hi, I'm Alexia and I'm a senior teacher at SLC. In today's video, I'm going to show you how to use different question types when dealing with patients in English. If you are interested in this topic or topics similar to this, why not check out our English for Doctors course, where you'll learn the English you need to help you work and study in an English-speaking environment. All right, let's get started. So in this video, we are going to look at different question types that you can use when dealing with patients in English. We will look at types of questions, indirect questions, and funneling questions. What should I consider when interviewing a patient? Using appropriate questions when dealing with a patient will help put the patient at ease and find out the relevant information in an effective and respectful manner. So let's look at the different types of questions you can use when interviewing a patient. Open questions. These types of questions give patients the opportunity to give information freely and share their experience and concerns. It is a good idea to start with open questions at the beginning of the conversation. Closed questions. The answers to closed questions are more limited and will help you to find out more specific information. Questions with options. Using these types of questions can help guide the patient to give useful and important information. Summarising. By repeating and summarising information that the patient has given you, it can help check information and give the patient the opportunity to correct or confirm the information, as well as allow the patient to add more information. So let's look now at some examples. Let's start with some open questions. What is the name of your GP? Can you tell me a little bit about the symptoms you have been experiencing? How does the pain impact your daily life? As you can see, these questions are broad and allow the patient to give the information from their perspective. Starting with open questions will help begin the conversation effectively. It is then a good idea to move towards more closed questions, such as, are you in any pain? These types of questions will help you to find out the specific information that you need to know. You can also use questions with options. For example, do you mean clear liquid which is odourless or yellow discharge which smells bad? So, does it only hurt when you stand or is it worse when you stand? These questions will help guide the patient towards giving important information. Another effective communication skill is summarising. For example, so I just want to check that I have understood correctly. You said that the pain started 3 days ago and it has been getting worse. Is that right? So from what I understand, you ran your hand under the cold tap after burning it. Is that correct? Now let's take a look at indirect questions. Indirect questions can be used to give the right level of formality and to soften questions that patients may feel are personal. So first, let's take a look at some examples of direct questions and turning them into indirect questions. When did you start taking the medication? Could you tell me when you started taking the medication? What did you do after that? Could you tell me what you did after that? Where exactly is the pain? Would you mind telling me where exactly the pain is? Are you in any pain? I was wondering if you could tell me whether you are in any pain. Did the patient have his operation? Could you tell me if the patient had his operation? Now we are going to look at some things to consider when using indirect questions. Below, you can see some more examples of indirect questions As you can see, the question word comes after the introductory phrase, highlighted in green. Auxiliary verbs aren't used in present simple or past indirect questions. The word order and verb form are the same as affirmative sentences, as we can see highlighted in purple and red. The subject comes before the verb, and for yes, no questions, we use if or whether, as we can see in the example. I wondered if you could tell me if he is allergic to anything. Now you can try. Read the direct questions below and make these direct questions into indirect ones. Number 1. Did you do anything to the burn? Number 2. Why don't you want to take the medication? Number 3. Is there anyone in your family with a history of kidney disease? Number 4. What are you worried about? Number 5. Are you in any pain? Number 6. How did the accident happen? Let's take a look at the answers. Number 1. Could you tell me if you did anything to the burn? Number 2. Would you mind telling me why you don't want to take the medication? Number 3. Could you tell me if there is anyone in your family with a history of kidney disease? Number 4. Could you tell me what you are worried about? Number 5. Can you tell me if you are in any pain? Number 6. I wondered if you could tell me how it happened. Now we are going to look at funneling questions. This will help you start with open questions and work towards finding out more detailed information. You funnel questions by starting with using open questions to broaden the conversation, then move through more focused questions and end with close questions. Let's take a look at some examples. Can you tell me what you were doing when you had the accident? Which piece of equipment were you using at the time? Did you use one of the small knives? Now you can try. Put the examples of funneling questions below into the correct order from open questioning to detailed questioning. Can you tell me what brought you into hospital today? Can you show me where the pain is? When did the pain start? Could you tell me more about the pain? How many units do you drink per day? How would you describe your alcohol intake? Could you tell me if you drink every day? How often would you say you drink alcohol? Let's take a look at the answers. Can you tell me what brought you into hospital today? Could you tell me more about the pain? When did the pain start? Can you show me where the pain is? How would you describe your alcohol intake? How often would you say you drink alcohol? Could you tell me if you drink every day? How many units do you drink per day? So let's recap what we've looked at in this video. Use a variety of question types. Open questions are more appropriately used at the beginning of the conversation, which will give the patient the opportunity to give information from their perspective, and closed questions will help you to find out more detail. Include some indirect questions. These will help you use the right level of formality and soften any personal questions. Consider using funneling questions. This will help you gain the information you need progressively, working towards finding out more specific information. So let me know, how do you start an interview with a patient in English? If you have found this video useful, please like, subscribe and share. And if you would like more materials like this one, whether you are a teacher or a healthcare professional learning English, you can contact us using the links in the description box below. Thank you for watching. See you next time. Bye for now.